Mr. London, how are you today, sir?
I'm great to see you again.
It's getting to a point where I am excited every time you come in here. You've met all the standards and expectations that you should, in my opinion.
Appreciate that.
Keep
I'm
up
happy
the
to
good
be
work,
here.
sir. We'll start in 1 minute. Not to say that Ms. Flores, Ms. Curtis, you guys are doing a great job too, Mr. Galucci. Mr. London and I have got this kind of engagement back and forth.
I understand, thanks.
Good morning. Subcommittee will come to order. Thank you all. Thank you, the witnesses, for being here today. We're here to take a closer look at the Department of Veterans Affairs management of its contract disability compensation examination program. The decision by a VA employee to grant or deny a veteran's claim for disability compensation often depends on the results of a disability compensation exam. Over time, VA has become increasingly reliant on the 4 companies who currently hold those contracts with VA to perform these exams. Currently, over 90% of disability compensations exams are performed by contracted exam vendors. It's the VA's job to implement contract requirements and processes to ensure that all 4 vendors are appropriately scheduling veterans for exams, and veterans are not being forced to attend the same exam more than once. Veterans obviously deserve the best customer service and quality exams performed by competent medical professionals. I know that it is not easy for the VA's Medical Disability Examination Office to maintain strong oversight over 4 large companies with networks of tens of thousands of exam facilities and even more medical professionals. We must ensure the VA is keeping these private companies in line with VA's mission and providing veterans with the level of services they have earned. This is a competitive industry with contracts worth more than $10 billion. Ultimately, the disability compensation exam program directly impacts whether veterans can access the VA benefits they have earned. I appreciate that over time, the VA has modified the contracts and implemented new processes, resulting in meaningful improvements for veterans going through the disability exam process. Some VA efforts have been in response to oversight hearings we have held in Congress, and I'm glad that the VA has been listening. We still hear concerns from our veterans and VSOs about issues with scheduling and rescheduling, exam reworks due to mistakes, and varying degrees of customer services depending on the vendor. Ultimately, these issues only further delay veterans receiving their benefits. Some veterans have been automatically scheduled for exams without prior notice, while others have received phone calls and text messages providing them the opportunity to respond with their preferences, including information regarding any wheelchair accommodations they may require. Veterans have reported difficulty sometimes traveling upwards of 100 miles for an exam, and VSOs have reported exams being held in hotels and spas. We continue to hear stories about contract exam being reworked again and again, unfortunately, though we understand the rework exams make up a small percentage of the total number of exams completed. Given the increase in the exam workload following the passage of the PACT Act, it is more important than ever for us to show that VA can continue to improve its oversight over the contracted disability compensation exam vendors, whether through contracted modifications or implementing new processes within the confines of the current contracts. I look forward to the discussions with our witnesses today. I now yield to the ranking member for his opening statement.
Well, thank you, Mr. Chairman. Thanks to our witnesses for being here for this critical discussion on VA's C&P exam process. I think it's evident from the ongoing work by VA OIG and GAO that the VA still has significant work to do to ensure that veterans receive their exams promptly and conveniently with thorough and accurate reports. It's essential that veterans obtain the benefits they deserve for medical conditions stemming from their military service. We owe them no less, and the exam process is a critical part of ensuring that they receive these benefits. I look forward to continued collaboration with you, Mr. Chairman, with the witnesses, contractors, and the VSOs to guarantee that our veterans receive the care and benefits they've earned and deserve. I urge all our witnesses and the contractors appointed by VA to conduct these exams to recommit to enhancing the veteran experience in this process. While timeliness and quality are important, the way veterans are treated in the process and scheduling exams, both in terms of timing and location, is equally vital. I'm struck by stories from my constituents, people like David from Merrimack. David was, like so many other veterans, and he's filed a claim with multiple contentions requiring multiple exams from multiple different specialists. And while he was able to be examined for one of his claim conditions, only after intervention from our office, by the way, He is waiting months and hasn't heard back on any of his other follow-up for other exams for other conditions. Another constituent, Charles, from the town of Milton, filed a claim for pulmonary condition, and the C&P contractor couldn't schedule that exam for him unless he was willing to wait over 6 months or drive over 300 miles because the contractor didn't have a specialist in the area. And even then, the veteran only received an appointment through intervention from our office. Neither VBA nor a contractor communicated with this veteran directly once his appointment was actually scheduled. So we all have stories like this, and I suspect we're going to hear more today. But unfortunately, these are too common, and it's clear to me that the ecosystem around compensation and pension exams is out of balance, and that's to say nothing of the actual quality of the exam once it's finally scheduled. I understand the volume of exams presents a logistical challenge for VA, and in states like mine with a significant rural population, geography presents challenges too. VA can't be all things to all people in all places, so these contractors are necessary to fill in the gaps. But it's imperative that VA understands that the ultimate responsibility for the care and treatment of the veteran is theirs. As such, they need to take far more of a hands-on approach, both to the actual scheduling and the conduct of exams and to oversight of those contractors they rely on to expand the network. So hopefully we'll hear more from VA about concrete plans to address the remaining GAO and OIG recommendations and how they'll better ensure contractors are focusing on veteran-centric customer service, not just the bottom line. So I thank you, Mr. Chairman, I yield back.
Thank you, Ranking Member. Our panel today includes Mr. Ryan Gallucci, a veteran and Director of National Veterans Services and Veterans of Foreign Wars of the United States. Today's lead witness from the Department of Veterans Affairs is Mr. Jeffrey London, Executive Director, Medical Disability Examination Office, Veterans Benefits Administration. Mr. London is joined by Ms. Tara Flores, Director of the Acquisition Services, Strategic Acquisition Center, VA Office of Acquisitions, Logistics, and Construction. Good Lord, that's impressive. And the panel also includes Ms. Elizabeth Curda, Director of Education, Workforce, and Income Security at the Government of Accountability Office. I ask the witnesses of our panel please stand and raise your right hand. Do you solemnly swear that the testimony you're about to provide is the truth, the whole truth, and nothing but the truth, so help you God? Thank you, and let the record reflect that all the witnesses have answered in the affirmative. Thank you all for being here today. Mr. Gallucci, you're now recognized for 5 minutes, sir, to deliver your opening statement.
Thank you. Chairman Luttrell, Ranking Member Pappas, and members of the subcommittee, thank you for allowing me to testify on behalf of the VFW about my recent experience with VA's contract disability exams. As an accredited service officer, I have a professional obligation to understand the nuance of VA claims. As a service-connected veteran who recently navigated the exam process, I must note that it remains both personally and professionally frustrating. I filed 2 claims related to my service in Iraq over the last 2 years. Each time, VA issued an accurate decision. However, the exam process was neither efficient nor transparent. My experiences and frustrations over this time were not isolated to one vendor and more likely indicate problems with the program itself. Because of VA's self-imposed standards of speed and the rigidity of the contracts, whenever I'm ordered for a contract exam, the first vendor usually has to return it to VA. Then I have to take steps with my accredited rep to have VA issue a new exam request. Today I'll share my experience that spans April to July of this year for a claim that I filed in February. First, I recall being auto-scheduled by one vendor while I was overseas on business. Thankfully, my accredited rep helped me reschedule. I completed the exam and my lab work on April 22nd, but something seemed off. Knowing that VA's new regulations for gastrointestinal conditions were set to become final in May, I was surprised that the examiner asked questions in line with the old regs. When the examiner also asked about current imagery from a colonoscopy, I informed them that I had the procedure scheduled with VA coming up on July 10th. At this point, I assumed my claim was on hold as VA waited on me. In June, however, the same vendor sent me a text message indicating that VA had ordered another exam. My accredited rep explained that according to VA's systems, VA was likely seeking a corrected DBQ. I was confident that I would not need to appear for another exam as these clarifications are routine. I was wrong. In early July, the vendor called me to schedule another appointment. Before I could commit, I asked what additional information they needed from me. They didn't know. I asked if the original doctor had been asked to provide the information. Again, they didn't know. The date they offered was July 10th, the date of my procedure. When I said no, the only other option they could offer was July 17th in Dover, Delaware, nearly 2 hours away. I told them to return it to VA. Now, I have more resources at my disposal to handle this than most, and I was able to escalate the issue directly to MDEO and Mr. London. However, the following week, I still received a text message from a new vendor to schedule my exam, and again, they offered me July 10th. Thankfully, we worked with VA to complete my exam during the claims clinic at the VFW National Convention on July 28th, and I had a final rating 4 days later. From a policy perspective, the VFW has called on VA to offer veterans more agency over the claims process since at least 2016, when VA promised 30-day claims to veterans who worked with an accredited rep through the ill-fated DRC program. During COVID, VA showed flexibility when it ordered vendors to hold exams until veterans felt safe reporting. In 2021, the VFW testified before the Senate about COVID lessons, citing VA's flexibility and reiterating our call to allow veterans to drive the exam process if they so choose. Unfortunately, we were met with opposition because of VA's arbitrary 125-day timeliness standard, which was established out of thin air in 2010. Today, the average claim contains nearly twice as many issues as claims filed 14 years ago, making 125 obsolete, as it does not accurately capture veteran experiences or expectations. My condition required a general health interview, lab work, and invasive imagery. When comparing my personal obligations with availability of these services, completing all of this within 125 days was fairly unrealistic. Now, I want to be clear, at no point did I ever consider my claim backlogged, but VA certainly did, putting stress on me as the veteran and on multiple vendors trying to complete a rushed and flawed process. To me, this was at best sloppy and at worst wasteful. However, it makes sense that VA works this way because days pending is what everybody is always focused on, including VSOs and Congress. Meanwhile, accredited representatives and examiners are often left holding the bag when veterans like me or the veterans I cited in my submission for the record become frustrated. I knew what to do in this situation because I'm accredited, but from years of working with veterans, this is where we lose their trust as advocates. In closing, the VFW calls on this subcommittee to work with VA, VSOs, and exam vendors to craft better accountability metrics that reflect the total experience, and to ensure every stakeholder has access to the information needed to process claims. The VFW again asks VA to provide greater agency to veterans in the process, either in the contracts or at the point of application. We've invited these discussions over the past 8 years because this is what veterans expect. We've spoken to vendors who agree this would improve efficiency, satisfaction, and potentially reduce waste. At a time when VA is processing more benefits than ever before, we have the responsibility to make this process as user-friendly as possible. That is what veterans have earned. Chairman Luttrell, Ranking Member Pappas, members of the subcommittee, this concludes my remarks, and I'm happy to answer any questions you may have.
Thank you, sir. The written statement of Mr. Gallucci will be entered into the hearing record. Mr. London, you're now recognized for 5 minutes to deliver your opening statement on behalf of the department.
Good morning, Chairman Luttrell, Ranking Member Pappas, and distinguished members of the subcommittee. We appreciate the opportunity to appear before you today to discuss disability examinations administered by the Department of Veterans Affairs. I am joined today by Tara Flores, Director, Acquisition Service, Strategic Acquisition Center. Today, I will provide an update on the oversight of compensation and pension examinations, including how we hold contract vendors accountable and how we are improving examination access for all veterans. The Medical Disability Examination Office and its contract vendors have risen to the challenge presented by the PACT Act, effectively handling the surge in claims while maintaining a commitment to timely and accurate disability exams. This fiscal year, we have already completed over 3 million examination scheduling requests and 11 million disability benefits questionnaires and over 4 million appointments. Not only is VA completing more exams than ever before, we also have significantly expanded our capacity to meet the growing need of the veterans community. This expansion has involved recruiting more medical professionals, increasing exam locations, and leveraging telehealth technologies and mobile medical units to reach veterans in more remote areas. The PACT Act has provided a gateway for veterans who were previously outside the VA system to finally access the benefits and health care they deserve. Thousands of veterans, many of whom suffered from conditions related to toxic exposures, now have an opportunity to receive the compensation and health care services they have long been entitled to, creating a more inclusive VA system that honors the needs of all veterans who have served. Veterans are at the heart of everything we do, and the veteran experience is at the center of the exam process. We recently conducted a human-centered design study with our Veterans Experience Office partners and received feedback that scheduling, Traveling and attending exams can be extremely difficult for veterans, both physically and emotionally. We have taken that feedback seriously, and we are actively working to improve these issues for our veterans. VBA is also exploring options to allow veterans the flexibility to schedule their disability exams when it's more convenient for them, including a self-scheduling option. Additionally, to receive additional feedback, in April of 2024, VBA implemented improvements to the customer satisfaction survey process as survey cards are mailed directly to veterans, enhancing integrity as recommended by the VA Office of Inspector General. Additionally, the customer satisfaction survey was upgraded to include a VA trust score, enabling VA to gain deeper insights into the veteran's confidence in the exam process, like insights gathered through other veteran experience surveys across VA. From April to July of this year, the veteran trust score reached 92% for disability exams. VBA oversees 18 contracts and 11 ancillary contract support to oversee these contracts. Oversight for exam contracts includes performance metrics for customer satisfaction, quality, timeliness, and production. We hold weekly meetings and conduct corporate site visits to further assess and validate vendor contract compliance. We conduct frequent in-person site visits and virtual desk reviews to ensure provider locations meet VA standards that comply with the contract. In this fiscal year thus far, VBA has conducted over 400 site visits and 100 desk audits. Monetary incentives, both positive and negative, are part of every exam contract. Exam vendors are rewarded with positive incentives for exceeding performance targets and penalized when negative incentives when they underperform. Incentives and increased vendor networks have allowed VA to increase exam completions by nearly 37% as compared to last fiscal year. Our quality program reviews a statistically significant sample of DBQs for each contract vendor to ensure they are accurate and complete. Our quality review ensures that examiners comply with all government instructions, fully address all questions, and the exam report aligns with the information of record. We conduct a comprehensive trend analysis of identified errors, and we communicate with each vendor to drive performance improvements. Our standardized audit criteria has resulted in an aggregate quality score of 96.9% for the program. Additionally, we conduct special focus reviews on special exam types, providers, and error trends to further oversight and feedback. We are committed to the continuous improvement of medical disability exams, and we appreciate the authority provided by Congress to obtain contract exams for veterans and transitioning service members. Thank you for your continued support of veterans, their families, caregivers, and survivors. This concludes my testimony. I would be happy to answer any questions you and the subcommittee members may have.
Thank you, sir. The written statement of Mr. London will be entered into the record. Ms. Curdy, you're now recognized for 5 minutes to deliver your opening statement.
Good morning, Chairman Luttrell, Ranking Member Pappas, and members of the subcommittee. I'm pleased to be here to discuss GAO's work on VBA's program for contracted disability examinations. Veterans who have been injured while serving their country deserve timely and high-quality disability compensation decisions, and disability exams play a vital role in determining if disability benefits are warranted. These exams have largely shifted from VA medical centers to contractors who performed over 90% of the exams this year. VBA estimates that contracted exams will cost almost $5 billion in fiscal year 2024. VBA has faced challenges processing large volumes of disability claims, which is a key reason for it being on GAO's high-risk list since 2003. Currently, almost 250,000 claims are backlogged, and a main driver is the PACT Act, which resulted in adding numerous claims to an already overburdened system. Disability exams are a key part of the claims process, and mistakes can result in rework and delays. Given this context, there's little margin for errors, which can increase workloads and cost and delay veterans' benefits. My testimony today discusses, first, VBA's efforts to improve its oversight of contracted disability exams, and second, areas for improvement or further study. To improve its oversight efforts and manage its growing reliance on contractors, VBA established the Medical Disability Examination Office, or MDEO, in 2016. Since then, MDEO started its operations and has made continuous improvements based on its own initiatives and on numerous GAO and VA OIG recommendations. In our work, we've seen that VBA manages exam quality using a variety of quality control techniques, which we've grouped into 3 categories. 1, prevention. These techniques aim to prevent errors or low-quality work from occurring during exams. These include things like training and guidance. 2, detection. These techniques aim to identify exam errors that do occur, and these are things like the DBQ checklists. And 3, correction. These techniques respond to exam errors, things like contractor quality action plans and imposing financial incentives for performance. While VBA has put in place a number of important quality assurance processes, we found more could be done to correct the types of disability exams with the most errors. VBA provides contractors with information on the types of exams with the most errors, and contractors use this information to create quality action plans intended to improve exam quality. During our ongoing work, VBA began reviewing the contractors' quality action plans for the first 2 quarters of this fiscal year. However, we found that VBA began these reviews largely without procedures to guide implementation. In response to preliminary findings we shared, VBA developed written procedures last month. Nevertheless, these procedures do not include clear or complete steps. For example, the procedures do not specify how VBA will verify that contractors complete the corrective actions in their plans, or how VBA will assess whether these actions improve exam quality over time. We're recommending that VBA improve the clarity and completeness of its procedures for overseeing contractors' quality action plans. By improving the procedures, VBA will be better equipped to ensure quality and reduce rework. We also spoke to representatives of the 4 contractors and several veteran service organizations who identified challenges and opportunities for improvement. For example, while these stakeholders generally describe VBA's oversight as beneficial, contractors added that the exam requests they receive from VBA can be unclear. The process for clarifying these requests can add unnecessary time to the claim. We plan to continue assessing VBA's progress in addressing these challenges. Finally, VBA has taken steps to address the problems with contractor oversight that GAO and the OIG have identified since 2018. However, it has not yet fully implemented 3 of the 14 relevant recommendations. For example, VBA has not fully addressed our recommendation to improve its planning for allocating exam work to contractors. In summary, with the influx of exam requests and growing costs, implementing our prior and current recommendations would help the agency to improve its capacity to serve our nation's veterans. This concludes my prepared statement, and I'm happy to address your questions.
Thank you. The written statement from Ms. Curda will be entered into the hearing record. We'll now move to questioning. I recognize myself for 5 minutes. Ms. Curda, I'm making the grand assumption that Mr. Jacobs is well aware of what you just testified in front of us and is moving on that accordingly?
Questions with him about recommendation follow-up.
Okay, because I have a meeting with him coming up. I'm happy to engage with him on exactly what you just stated, but I'm just making the assumption that you guys have already spoken to his office?
Yes, and in response to our recommendation, they've discussed plans they have to implement it.
Okay, great. Mr. Gallucci, and Mr. Lund, I'm going to kind of throw this right down the middle there, and let's have a conversation. So, Mr. Gallucci, I'm sorry for your frustrating travel and journey through the system. I'm glad it was put to bed. So we have 4 contracting agencies, Mr. London, correct? 4. I'm curious on why we only have 4, and I'm assuming because it's regionalized and those numbers handle the workload. Given the numbers that we are deficit, do we need more? Can we have more, or have these 4 companies monopolized, for lack of a better term, the VA, the system itself? And I would say if we lose one, we are in bad shape.
First, let me go on record by saying, Mr. Gallucci, I also am very pained and troubled by your experience. It's not just your experience, it's every veteran that has a similar story. And you have my commitment, along with my team's commitment, to make sure that we get this right for all veterans. To answer your question, Mr. Chairman, with the current 4 vendors went through a competitive process, an open competition, where all qualified vendors were able to compete for the work. And just to make sure that we're on the same page, while we have 4 vendors, we actually have 18 contracts. So for 4 of the regions, we have 3 vendors, and for one region on the West Coast, in Region 4, we have the fourth vendor. So we have 4 vendors, but multiple vendors in each region.
And Mr. Chairman, may I add in a comment as well?
Sure.
One of the concerns that we have is when VA expanded to a 4th vendor, it didn't necessarily increase the capacity for doctors, especially specialists. What I would argue from what we've seen anecdotally as advocates is, especially when you're talking highly rural areas, adding that other vendor didn't add more specialists in that region. We've spoken to doctors.
Are there specialists in that region?
That's the challenge, exactly.
Okay, that's not something the VA can just create.
Exactly. So one of our concerns when they expanded to even that 4th vendor was, where are you going to find the specialists? We know many doctors, especially specialists. There was a doctor in rural New Hampshire who was contracted with all 3. She's not adding any more hours to her day to see veterans because there's a 4th contractor. I have concerns that the problem is much deeper and speaks to the availability of those services in the marketplace.
So one thing I've seen is that the vendors, but facilities, they seem to be leaving more than we are gaining facilities to help in this space. Is that a fair statement?
Thank you very much for the question. And just to make sure that we're on the same page, net, the 4th vendor did add new providers. They brought new providers to the entire program. But Mr. Gallucci makes a great point about specialists. And this is where the authority that Congress has given us, like the License Portability Authority, is so vital to help us to travel in those specialists, especially to rural and remote areas.
Bring them in, yes, sir.
And I would very much appreciate, along with VA and the veterans whom we serve, if Congress expanded that authority to include optometrists, dentists, advanced practicing nurses, so that we can serve even more veterans in those areas.
Correct. I don't know, VA is trying to gain momentum in bringing those specialties in. You said you had to travel to Delaware possibly, sir, for 2 hours. So my question with that is that because that's the only facility between you and that space that has what you need?
So, sir, this one was very confusing to me because I had seen a specialist. I live in Arnold, Maryland, right? And so I had seen at first a general practitioner, as a nurse practitioner, in 2 towns over in Glen Burnie. When VA called me for the rework, they offered me a date that I couldn't make. The only thing that they could offer me within the time frame they had to return it to VA was a general physician in Dover, Delaware, per whatever they had in the network. The problem with that, though, reading GAO's report, they're supposed to do that within 50 miles for a general. Dover is 62 miles from my home. So I'm not even sure why that was.
Was there anything within, I'm going to go long. Was there anything within the 50? I'm trying to find out, which this is very complicated, but if the VA can't find something in 50 miles, but 62 is sitting there, are they offering that up?
They did offer Dover, but that had more to do with the time frame.
You said 125 days is not realistic. You said 125, correct?
125 for what VA views as backlogged, yes.
So you want to expand that to a greater number?
I want VA to measure different things. I want VA to speak to the expectations that veterans have in the process. The time it takes to acquire records is very different from the time it takes to complete exams, imagery lab work, and then rating claims. VA is actually doing very well at the last part.
So here's the tricky part, because we, the committee, subcommittee and committee, are constantly hitting the VA in the face with a sledgehammer on, like, you need to get the numbers down. They have to be shorter. So if 125 is, you see where I'm going with this? If 125 days is too short, so now I'm at a pause. I'm like, okay, hang on for a second. If they're jumping out of their way to do everything they can, and it's not going to be comfortable for us, because the VA is listening to what we're saying. Is like, you will do this, and here they are trying to create this infrastructure that is very hard to manage in order to get everybody what they need. And of course, there's going to be mistakes, right? And we're trying to find that little sweet spot.
This is where I think there is a happy medium. And we had a conversation about 2 years ago with Mr. Frew and Willie Clark about this. And they were very concerned about their COVID backlog. And we had to have the realistic conversation that what you're viewing as a backlog are the veterans who have asked VA to pause their exams. There are 2 different numbers. Yes, there's the 125, and there are veterans who expect it to be done very efficiently, very quickly. But if a veteran has an extenuating circumstance where they say, look, I can't report, or I need more time, or if there's no specialist, I want to go to a specialist. Our ask is for the veteran to be able to drive that process, but then that VA and their vendors aren't held to account for, well, why'd you miss 125? Because the veteran asked.
Okay, I'll come back to that in the second round of questioning. I apologize, Mr. Ranking Member.
No, thank you, Mr. Chairman. Mr. Gallucci, thanks for relating your own experiences, which I think are real valuable. And we do have to understand that most veterans don't work for a VSO. They're not an accredited claims agent. And so they will endure a frustrating process. They might reach a dead end where they walk away. And so that's, I think, why your story is helpful for us to understand the problem at large and why we need to continue to work collaboratively on this. Ms. Curta, maybe I could turn to you. GAO reports are produced with data that's collected over a period of time. There are snapshots in time, maybe data that over 6 months or a year. And I'm curious how you project recommendations forward in time as events develop and can be fast-moving, as we've seen with VA and PACT Act implementation. How does GAO work to take data in a snapshot and help apply it as things progress?
Yes, well, I mean, if I had to take a look broadly speaking at many of our recommendations, a lot of them have to do with using sound planning practices, which remain relevant regardless of the challenging or the changing circumstances. For example, our recommendations focus on the discipline of developing plans that have stated outcomes, measures of success, get stakeholder input, such as from our colleague at the right, and actions to be completed with milestones and people assigned for responsibility to complete those actions. Now, no plan should be static. As circumstances change, plans need to change as well. They need to be living documents and reflect changing circumstances. Just in terms of our recommendation today, it's a pretty standard control practice to have good procedures for anything that you do. If you set out to achieve a goal, you want to have procedures that are clear and consistent for people to follow.
That's helpful. And can you tell me if there exists a true apples-to-apples comparison in terms of VHA exams and those conducted by contractors that we're talking about today?
We have not looked at that issue for a couple of years, but my most recent understanding is that it is not an apples-to-apples metric in terms of how the VHA assesses quality in VBA, but that may be changing. I understand there may be some efforts to synchronize them. Okay.
Mr. London, maybe I can ask you that question. If the agency directly compares total costs for disability exams performed by VBA contractors and those performed by VHA medical centers, and if you've looked at that, and if so, what the results are?
Thank you very much for the question. We have not looked at that, and mainly because when you look at the scope and scale, it really is apples to oranges. I'll give you just one data point. My last look at the numbers in VHA, don't quote me on this, but I believe that they have approximately 500 or 600 examiners across the nation who do this work, and the MDE contractors, in comparison, have close to 16,000 providers. So to do a comparison would be challenging, but when you look at net cost, there's not a significant difference in studies that we looked at in the past, but the scope and scale is very different.
Okay. VBA's previously stated that the quality of VBA contract exams is comparable or better than the quality of VHA exams, but we understand the study that VBA conducted on VHA exams was a one-time review that looked only at virtual disability exams that were performed within a 2-month window during the pandemic. So can you talk a little bit more about the quality of VBA contract exams, compared to those more broadly?
Sure, thank you very much for the question. In essence, both quality review programs look at the same thing, to ensure that the DBQ for the specific claimed condition from the veteran is completed fully and accurately following all of the DBQ instructions. So regardless of what questions are asked, that's in essence what it's getting at. And so when you look at how we assess the vendors and how VHA assesses their providers, the results are really similar. It's around 97 or 98%, regardless if it's a contractor or VHA.
Okay. Thank you. I yield back, Mr. Chair.
Thank you, Mr. Pappas. Mr. Franklin, sir, you're recognized for 5 minutes.
Thank you, Mr. Chairman. And I'd like to follow up on Mr. Pappas's kind of line of questioning because it's something that's been kind of weighing on me. Obviously, we want better, faster, cheaper for our veterans, quality being the most important. Obviously, we want timely care, but it's got to be good care. And Mr. London, you're just talking about the accuracy of DBQs. Across the 4 different vendors, is there any, and Ms. Carter, you probably can speak to this too with some of the procedures you were lining out, but are we looking at, how do we know that a veteran's getting the same shake depending on the veteran or the vendor that they're using? Is there consistency across there, and do we know, can we prove it?
Yeah, thank you very much for the question. So our standard per the contract is to at least have 96% quality for the DBQs. And so as I mentioned, the program aggregate number is almost 97%.
But how do you define quality?
Sure, so it's essentially, as I mentioned, looking at the DBQ instructions based on the specific claimed condition, we are actually assessing that the provider completed that DBQ per the instructions, looked at all the evidence of record, followed all of the procedures that it needed to make sure that that report was accurate so that the claims processor can use that for rating purposes.
So when we're talking about looking at all the evidence that's available, my understanding is now a lot of these 4 vendors are leaning on outsourced artificial intelligence to help them assess a veteran's files. Is that accurate, to go through all the documentation there to expedite the process? How is AI being used in this?
Sure, thank you for the question. VA provides the vendor with the entire claims folder for every single veteran, and that also includes any tabulations or bookmarks that the claims processor actually used when they've reviewed the file. So the vendors have access to that. What you're referring to is on top of that, they're utilizing technology to organize the file to further enhance it so that the provider, when they're sitting down to complete the DBQ, will have that information available as well as the entire file that they can also refer to complete the DBQ.
But would it be safe to say with metrics and they're being judged and bonused and everything on how basically output, it seems to me it's going to be human nature that they're going to rely more on that more on the AI to expedite rather than go through the whole file if they've got artificial intelligence that's already provided them a summary. I guess, I'm concerned that, rephrase it, are you confident that if you gave the same file to the 4 different vendors, that they're going to end up giving that person making that final determination the exact same data with which to make that determination?
Thank you very much for the question. First, the entire e-folder that we give is searchable by the provider, and a lot of the technology that the vendors are using is enhanced searching capabilities. So it's not just a summary, it allows the provider to access the information that is included in the record that VA provides. So it's really making the search more efficient for the provider who's completing the DBQ that has to review the medical record.
Do you have the same level of oversight or eyes on with the technology that they're using as maybe VA claims processors use when they're using AI to help make a claims determination? Or is it sort of, because what I hear a lot of times from the vendors is, it's proprietary, we don't want to share what we're doing, but are you confident that you know what's under the hood making those decisions?
Sure, so we have, in many cases, we have access to vendor portals so we can see the information and what they're seeing. And I mentioned in my remarks and in my written testimony as well that we conduct corporate site visits, so that's a time to go into their secure facilities and actually see their systems firsthand and to actually see what each part of the process, what's happening. So we have assurance that the information is getting to the providers.
Great, thank you. Mr. Chairman, I yield back.
Thank you, Mr. Franklin. Mr. Self, sir, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I've heard that Mr. Gallucci and Mr. London are both frustrated, as am I, Mr. London. Almost every hearing, I make the same comment. I'm frustrated with your testimony. I'm not sure you're testifying for Congress. You may be testifying for those people watching the video. Always give us a very rosy picture about where we stand. I always like to, you always tell us your inputs, never the outputs. And you mentioned 96.9%, I think, approval rating for the program, if I caught it correctly. So my first question to you, Mr. London, is why are we holding this hearing?
Thank you very much for the question. And again, I share your frustration as well. And even though we're at 97% for quality, I'm not satisfied. And that's why we work tirelessly with the vendors to ensure that we can increase the accuracy of everything that we do. So while we may be at 97%, not resting there, well, we want to get to 98, we want to get to 99, may not get to perfection, but we're going to make sure that every veteran gets a fair and accurate examination when they come to our program for assistance.
I would have answered that question. We're looking at the 3% that you're not getting. So my first question has to do with the increase in cost. By my calculation, the increase in cost has for each exam has gone up. Why?
Simply put, one, we have more work to do, and the work is more complex, and mainly because of the PACT Act.
So you've told us that you need almost $800 million to pay for the contract exams by several days from today, like a week from today. You need it now. What portion of that $800 million, almost $800 million, is due to the increased cost in exams?
So if you look at the average cost of an exam scheduling request, and here's where it gets a little bit tricky because every exam scheduling request is unique to that particular veteran and the claimed conditions that he or she or they are presenting to VA. And so to make the math simple, the average disability benefits questionnaire is roughly $600. So if you have multiple claimed contentions based on that veteran's needs, the cost can scale up based on how many claimed conditions. So we've seen the overall exam scheduling requests go up almost over $300 for the exam scheduling request.
Wait a minute, you said $600?
$300.
No, 600 total? You start with 600 and it's gone up by 300? Is that what you're saying?
No. What I'm saying is the average DBQ cost is $600. And what I'm saying is the exam...
I think the average for every ESR is like $1,500 today.
That is correct. A DBQ is for one claimed condition. If you have 3 claimed conditions, you now get to $1,500.
And it's gone up by $250, by my calculation, $253. We'll use your 300 if you want to.
Yes, sir. Yes, sir.
$253 for every rework. It looks to me like getting the reworks down would be a key component of this. Mr. Gallucci, you've got your hand up.
Yes, Mr. Self, thank you. This really prompts a response from me because looking at my personal experience, but also what we see professionally, the rework in my specific instance was almost inevitable because at some point there wasn't an update to the regulations or the questions that the vendor was going to ask. Ms. Curtis' testimony spoke to this with the GAO about the speed with which VA is able to provide those updates to the vendors. I think it's instructive what Ms. Curta has found alongside what our accredited advocates experience with the veterans that we work with. Rework is rampant.
Okay, I understand, and that's my line of questioning here, because how much of the rework is based on an improperly worded request versus lack of flexibility? Let's just leave it at those two. How do those two compare, Mr. London?
So overall, rework is about 7% of the work, depending work that we have. 2% of that is where the report itself was deemed inadequate for rating purposes, and the vendors do that work at no cost. The other 5% of the rework are what we call clarifications, where the claims processor is asking for additional information from the vendor. Again, that's at no cost. What I think you're referring to is a case where it's not necessarily rework as I'm defining, but a case has to go back similar to what Mr. Gallucci talked about in what I heard from you, sir, was that it really was a timing issue where the exam happened in 1 month and the regulations being
Flexibility,
updated. So
correct.
flexibility.
Yes.
So when I hear that, and that's where it really caught my attention, because you make a great point about the timing, and that's a perfect situation where what VA could have done is held Mr. Gallucci's exam after the new regulation came into account. So he makes a very valid point there of being more flexible and also addressing the concern that you're highlighting, sir.
Before I yield back, Mr. Chairman, I'll just say, I'll use an old engineer saying, you measure once, you measure twice so that you only have to cut once. I think if we'll adopt the engineer's point of view of measuring, getting things right before you start would be a big help. Mr. Chairman, I yield back.
Second round. Any other questions, Mr. Franklin? Mr. Self? I'll give you the floor if you want it. Mr. Gallucci, so since I have you sitting here in front of me, as you're well aware, every veteran's different, no matter where they live or what they're doing. If you were to have a few takeaways from your experience that we could share with the panel and the committee, because I'm always about the next step forward. I don't want to walk out of here without a trajectory of what we're going for the next time that this crew is sitting in front of us. What is it that they could streamline? What Mr. Self pinged on pretty hard. What is it that one tweak, those two tweaks, where we're chiseling away to try to open up the bottleneck for you and the rest of the veterans? Can you send that down range, please?
For me, it's as simple as offering veterans to drive that process. Now, I get it. When a veteran files a claim, VA has a statutory duty to assist. They're going to acquire your records. They're going to order you any required exams. If there are extenuating circumstances that the veteran can't report or it's inconvenient, like in my instance where you want me to report on the date of my colonoscopy related to this claim, that's not happening. Why do you keep asking me to come in on that date? I would really appreciate it if you could move it a couple of weeks to the right. But holding it to the 30-day standard that it has to be back within 30 days, holding it to we have to rate on 125, it ends up putting stress on the veteran, it puts stress on the advocates. I would ask for similar to what VA tried with the Decision Ready Claims program and what they did during COVID-19. When veterans say, hey, pause, great, we will pause and we will keep up regular contact with you to get this done, but you've asked us to pause. That's what you want as the veteran. They did it during COVID. They tried to develop a business process that did it during DRC. We're asking for discussions on that, and then we can measure it. Hey, how many claims are paused, and why are they paused? During COVID, as accredited advocates, we did outreach to make sure that veterans would report for those exams. And when VA came to us to explain their backlog, we decided we weren't using the B word because that's not what was happening. Veterans were concerned about appearing for their exams, and we were working together to make sure that they came in and did what VA needed them to do.
Okay. This was going to get a bit tricky. So I see where you're going with this, but we have to have the VA, they have to have definable lines. And you heard me say earlier that veterans are extremely hard to wrangle. So if I got something I need to be or something pops up on the specific date that I have to have an exam, I can't tell the VA, I can't kick that can down the road over and over again, because inevitably what's going to happen is it'll start to spread in a bad way, okay? So we have to find the middle ground here. And so my question back to you is, are we in a spot, okay, is the VA positioned in a spot that works, not perfectly, but I don't want to be perfection to be the enemy of good, okay? Because you got to remember the machine here, the big machine. And you can imagine how challenging it is for us to try to steer that thing. So if we give the veteran the ability to flex left, right, of center at any given time, where does that put the VA? And Mr. London, you could probably jump in on that too.
So I think VA has some very strict timelines anyway. Usually the standard is within 1 year. We have the intent to file form. You have to file within 1 year or you forfeit your effective date. There's ample precedent for VA to be able to do this. I would argue, and this will probably warrant further discussion with a lot of our SMEs behind the scenes, 1 year. I mean, why not 1 year? I'm throwing that out of left field, but the reason is because, look, veteran, you paused your claim, you have 1 year, we're going to rate without it.
Ooh, hey,
There
I wouldn't
is-
say that out loud. You'd be surprised how people jump all over that in a bad way.
Well, the reason I say 1 year is because that's what VA tried to do with the Decision Ready Claims program. Again, when they instituted this program, my opinion on that was the rollout was bad. What they messaged to veterans was, work with an accredited representative, you'll get a claim in 30 days. What they didn't say was, work with an accredited representative to develop your claim. Acquire all your records, complete all of your exams, and then officially file your fully developed claim, and we will rate it in 30 days.
Which is what Ms. Curta is saying Mr. Jacobs is going to try to address. Correct? I know you weren't paying attention, Ms. Curta.
No, I was. I think it's a slightly different topic.
Okay, all right.
So there was precedent there, and it was 1 year. Basically, what the accredited rep would do is file the intent to file, and you've got 1 year to complete this, or
That whole water, Mr. London?
So that's getting a little bit outside my lane and getting more into the claims process, but here's what I'll say as it relates to the exam process, that's a part of the claims process. Mr. Gallucci makes a very valid point from a veteran perspective. I wasn't just saying those words that I said in my testimony just because they sound good, that the veterans are at the center of everything we do. They certainly are at the center of what I do every day. So I believe that from an exam perspective, we can take some reasonable steps to be more flexible to work with veterans. To your concern, we need to make sure that we have governance around what that flexibility is so that things don't go too far to the right, so then we're upsetting veterans overall by their claims taking too long. So we are working on those solutions. We obviously, this is going to impact policy, this is going to impact the timelines, but I believe there's something that we can and we should do to get more flexibility.
Okay, thank you. Mr. Pappas?
Thank you. Mr. London, I just wanted to put one more issue out there that we've heard about directly from veterans, and it's a case where a claim might require more than one exam, and sometimes these are contracted out to different vendors. We've heard from veterans that have needed 2 exams that have been scheduled on the same day in different cities with different contractors. And so I think that speaks to a lack of coordination. And I'm wondering if you've heard of that phenomenon and what VA can do to, I guess, create a more efficient process where we understand kind of the range of exams that are out there for veterans and how that can best be handled. Is it just one contractor that needs to do it, or is it just better work on your end to help schedule that?
Thank you very much for the question, and I'm actually extremely grateful for the question because this is something that's been on my mind over the last several years since I've been here. And I think the fact that we're recompeting the contracts as we speak creates an opportunity for us to address exactly the point that you're making. So the good news is this is top of mind, and this is something that we plan to solve when we recompete for the long-term contracts next calendar year.
And so what are the possible solutions to
Sure. So I think quite simply, even using the example that you gave, is that, having, and again, this is putting the cart before the horse. We have not, fully developed the concept, but in broad terms, it could be as simple as if Mr. Gallucci files, with his claim, making sure that all of his exams are with one vendor. It can be as simple as that, including even to Congressman Self's questioning about rework, making sure even that there's continuity in what's happening. So those are some simple concepts that we're thinking about implementing to address those issues.
Okay. We look forward to hearing more. Thanks.
Thank you to all our witnesses for testifying before us today about the important issues of ensuring VA effectively manages the contracted disability examination vendors whose services directly impact whether veterans receive VA disability compensations benefits. Thank you to the ranking member. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous materials without objection. So ordered. This hearing is adjourned.